Okay, we have 2 responses so far. Okay, 3. Okay, in the interest of time, I will go ahead and close the voting for now, and we'll get another chance at the end of the webinar to take another look at these questions. So my apologies if you're still, I know they're pretty lengthy, but if you're in the middle of your submission, don't worry, you'll get another chance to answer these questions. So without further ado, I'll turn it over to Dr. Camden so she can go ahead and get started.
Thank you, Sido, for the introduction. And hi, everybody. And thank you for joining me today so we can discuss the compounding 101. Can anybody hear me? Let me know if you can hear me. Okay, by the end of today, we should be able to have an idea of the history of compounding, list different type of compounding, the requirement as far as education and law to be a compounder, the different type of formulation and equipment that we use in compounding, and the beyond use date and storage. Okay, let's start with the history of compounding. Compounding is not something that just started today. Way back in the ancient time, that was the only way to make medication, and the physician was the only person that was available to make the compounding. The physician used to prescribe the medication, make it on the spot, and give it to the patient. And with the need, the need going increasing, and the pharmacist's job being created, the physician was not able to meet the demand, because even to do the capsules, they didn't have any equipment to make like a batch of capsules. They used to load them manually, and it was time consuming. So it shifted from the doctor's office to the pharmacist, where the pharmacist was the one now making the compounding. But the industry growing and the manufacturing taking over and mass producing, the compounding kind of go away. And recently in the 20th century, the pharmacists came back again and started compounding, because we had the need to custom the medication, a lot of side effects and complaining from the customer. So that's how we progress to go from the physician now to the pharmacist making the compounding. What is compounding? Compounding is the art and the science of creating personalized medicine. Like I said, compounding is a great option in several cases. We have customers who are allergic to mass-produced medicine. They can't take gluten, dye. Compliance, one size fits all. We have medication that is already made, and some people are bigger, some are small, and the same medication won't produce the same effect. It could be toxic for somebody. So that's where we step in and custom made it to the patient. You have a patient who cannot swallow tablet. We can make it capsules or liquid cream, anyway, to help with compliance. The different type of compounding. We have the traditional compounding, non-sterile, which is what I do. I don't do sterile yet. A simple compounding is we get a powder like amoxicillin or a tablet that is commercially available, crush it into a liquid or make a cream out of it. Moderate compounding requires calculation. We do a lot of titurations to find the right dose because the amount that we're making is so little that the balance cannot see it. So we do a lot of calculation to dilute, make the product bigger so we can see it and get the amount that the dose, the correct dose to the patient. And complex compounding requires special training, the equipment, the environment, the facility, the procedure. And again, with complex compounding, a lot of calculations as well. You're mixing several products. Sometimes we go up to 10, 12 products to just make one medication. And compounding, you can make anything that you can think of. Now, the most popular today is the hormone replacement therapy. Nobody wants to get old. Everybody is doing, trying to keep the hormone balance because with aging, our hormones go down. And with today's society, nobody wants to get old. So we get a lot of customers with hormone replacement therapy, keep the hormone at a level that we had when we were younger to stay young. Pain management, a great option to help with opioid crisis. We do a lot of cream for pain that help, patches for pain, and there's no side effect, there's no addiction for those. Hospice, we help patients go to their last home by doing hospice medication. A lot of those patients, they're not conscious. So we have to give them something that is not by mouth. So all the medication that they've been taking, we usually turn it into creams that the patient, the nurse will apply to the patient and help them. Neuropathy, those are examples of different things that we can do with compounding. Dermatology, great, option for sensitive skin, anything you can think. We have doctors calling. If you have a special case, they don't know what to do. They submit the case study to us and we come up with a solution for that patient. Dentists, a lot of numbing agent, mouth rinse for gum, teeth. We do a lot of those. Sport medicine, wound therapy, diabetic patient with wound that won't go away. I have a case, a patient who got this wound for 3 years. They didn't know what to do. And when I opened, the daughter came here and she started asking me about what I could do for her mom. I asked for the picture. It was really nasty, a really, really nasty wound that mom was carrying around for 3 years. So I got that. I work with PCCA. I called them and the clinical staff there, they helped me come up with a cream that we made here for mom. And believe it, after 6 months, the wound was gone, like it never was there before. Fertility and fertility, we do a lot of progesterone, vaginal suppository for mothers to keep them. Some of us don't have enough during pregnancy, so they need extra. And the suppository is the best to keep the level steady in the body and keep the baby there. Pre-treatment to get women pregnant, we do Viagra, the sildenafil suppository too, to help them be fertile, testosterone cream, all that to help them the egg produce the egg and get pregnant. Pediatrics, a lot of diaper rash, suspension for newbies. We have a lot of newbies with AFib. They cannot take, there's nothing available for them. So we have to make their medication, compound it and make the dose. So usually you have a baby and you have to make the strain like 0.1 ml for the baby because you can give them like 5 ml at a time. Compliance will be an issue. So a lot of math to make those prescriptions. Medication flavoring, a lot of troches, Ophthalmic, the ophthalmic is usually non-sterile. Sterile, the only ophthalmic that we make is for the eyelid. It shouldn't go anywhere close to the eye. And you have testosterone cream that we make here for the eyelid that helps with dry eye. Podiatric, I put the aspartic acid for very nasty wart, very, very efficient. It's not commercially available. We have to make it. Also, people with GI problem, we can make the prescription for them as well. We do a lot of budesonide suppositories. Okay, what are the requirements to be a compounder? Actually, up till today, there's no law requiring a compounder to get a certificate. But to be confident doing your job, I will ask anybody who is interested to get some training. And there's several companies who offer training and will make you feel confident. I use PCCA, the Professional Compounding of America. That those are the ones who train me. They do the webinar, and then you have a week of on-hand training where they train you to do capsules, suppositories, all the different type of compounding, and then you're exposed to the equipment that you will be using during compounding. But there's several companies out there. Medisca does it, Letco does it, ICAP. You have a lot of company out there who offer the training, and for me, it's a must because coming from retail, I don't think I would have done it without any training because even the prescription that we receive as a compounder, believe me or not, I couldn't read them the first time I started. Most of them, I will call PCC and say, I have this, I don't even know what it is because the abbreviation, everything is totally different. So, and the doctor, because you open a compounding, they expect you to know, to be able to read the prescription, understand it, and make it. And also, all personnel involved in non-steroid shall be well trained and must participate in continued relevant training program. This is the only law requirement. The training you can implement your own training. You don't need to go through a school or get a certificate. Like for my store, I did the training and I wrote the training for my staff. So any new hire that who comes here, I train the new hire. I have a training manual that I put together. They do it and then we sign the acknowledge. Okay. Now starting, but let me not jump there. Yeah, I'm sure some of you are like, what is the difference between compounding and manufacturing? Because it might seem like we're manufacturing when we prepare prescriptions here, but we are not. When you manufacture, you including a preparation and you promoting a commercially available product. So when we compound, we don't promote what we do and we don't compound commercially available product. Let's say amlodipine 5 milligram, tablet. I cannot compound amlodipine 5 milligram tablet. But if I have a patient who is complaining and the doctor has it on record that that patient cannot take the tablet, they're reacting to the tablet, I can make it capsules and make sure I'm not putting the same ingredient that the capsule has, the tablet that is commercially available has. Okay, what are the responsibility of the pharmacist in charge? Just like a pharmacist in charge in a retail setting is the same. And also the pharmacist in charge is the one superseeing the education, the training, and making sure that all the compounding done in the facility are being supervised and all the rules are being followed. So during the audit or inspection, if anything goes wrong, it's the pharmacist in charge because the pharmacist in charge should maintain the record of all the training and continue education. And when you renew your license, because you do compounding, you're required to get a 3 hours continuing education on compounding and all the personnel, pharmacist, technician. And when you do the training need to cover the equipment as well. Okay, pharmacist. Again, there is no law requirement to have a certificate, but it's recommended to get a training. The only training that is mandatory is the continuing education, 3 hours continuing educations. And also during the process of compounding, the pharmacist is in charge to inspect and approve all the components, the drug, the container, closure, labeling, all the material used during the compounding, and also make sure that the record and accuracy was done during the process, and check and make sure the final product is error-free. Also, the pharmacist is responsible of the proper maintenance, cleanliness, and use of all equipment used during the compounding process. And at the end of each compounding, it's required by law to keep a log of all the chemical used during the compounding. Okay, I see a question here regarding amlodipine example. Yes, if we get to compound a commercially available product, we don't use the tablet. We don't crush the tablet and put it in the capsule because the patient got a reaction to the non-active ingredient is in that tablet. So we buy the bulk chemical, which is straight amlodipine, and from there we will make the capsule or the suspension with that amlodipine. I hope I answer your question. The record, we keep the record for 2 years of everything that we do here is for 2 years. Pharmacy technician, they're also required to have the continuing education. The training is required as well, and the pharmacist in charge is responsible for the technician training. And like I said, it doesn't have to be through a school. You have the internal training just to make sure they know how to use the equipment, they're familiar with the SOP, with compounding. And they cannot compound if a pharmacist is not on site. It has to be under direct supervision of the pharmacist. Okay, operational standard. Non-steroid drug preparation may be compounded in licensed pharmacy. These are the cases where you can do a compounding. You cannot just compound and sell it to your friend. You need a prescription from the doctor to fill the prescription. And the prescription, you need to make sure is a valid prescription, that there is a pharmacist-patient prescriber relationship. But the law allows us to compound in anticipation of prescriptions. The most popular ones are capsules, troches, and suppositories because they have a longer shelf life, 180 days. So the ones that we make a lot, we make them in batches of 300 and keep them because we know we'll be run through it. And it's time consuming to make only 30, 14 capsules at a time. And whenever you make batches prescription, you need to make sure you label them properly with the name of the drug, the strength, the lot number, the beyond use date, the quantity in the container, the name of the compounders. If a technician made it, it will have the name of the technician and the name of the pharmacist in charge that day, and also the day the medication was made. It's usually included in the lot number. Can we compound for office use? It's very tricky. Texas law says yes, and everyone need to check with their state. But the DEA says no. The federal law says no, we cannot compound for office use. I got a visit from the state board and I asked them, and they say yes, you can compound, even though federal law says, because it says you can do it in a reasonable amount, quantity. What is a reasonable quantity? Now there's a darkness there, so you can still compound for office use. And we have a few dentists that we do office use for. Okay, I think someone asked me earlier about the record. If you keep it, yes, this is where you keep the record for compounding. I have a slide for that. You keep it for 2 years, and you store your record the same way you store regular prescription. You have C2s, C3 through 5, and then legend. You do them separate. Okay, please go over the need of lot number. The lot number is specific, it's like the DNA of that prescription. Because once you make it, and if something happened, you don't need the name of the medication. With the lot number, you can pull the exact drug because it gives you the time where the drug was made, who did it, all of the information, the social security of the drug. That's the lot number. Expiration date, who made it, what was in it, what was the expiration date of all the ingredients that were used for that prescription. Okay, the garb and attire. To compound, you need to dress up properly. We don't want to have any hair in the patient prescription. You need to cover your hair with a net. If you have a male compounder, they need to wear cover their beard as well. We don't do the shoe cover because it's not sterile. We don't do anything on the floor. So shoe cover is usually for sterile. We have a gown. You need to be gowned completely all the way to your waist. You don't want to get any of the chemical on you. We do a lot of hormones. So if you're touching progesterone, testosterone every day and you're not gowned down properly, you're going to end up having your level high because you expose yourself to those every day. Gloves, face mask, and eye shield. You need to wear those to protect yourself. The equipment, again, it's not a law requirement. You equip your pharmacy to help you do your job. And for me, having everything here is very helpful. When I first opened, I knew I would do compounding and retail. So I gather all the equipment necessary to help me do my job every day. Graduated cylinders, syringes. We use syringes for measuring and dispensing as well. Some customers are very visual, they want to see the medication, so we put them in syringes for them. Yeah, we have an electronic balance that is connected to our computer. So whenever we measuring a chemical, we don't manually put the number in the log. We just send it through the balance for accuracy. And I feel confident coming after my relief pharmacist and checking her log because I know she didn't put anything in there manually. The computer will read the numbers on the balance and store it. And once you save your formula, you cannot go back and change it. Once you made a compound, you cannot go back and change something to it on it. It's locked. Mixing equipment, we have the traditional mortar and pestle, but we don't use it a lot. We have an electronic one that I will show you at the end. It's very convenient and very fast. It makes like in seconds. So we use that a lot for cream, capsules, everything. Ointment meal, we do a lot of cosmetics as well. The diaper rash is very greedy, so we have to mail it using the ointment meal. We have a pill tile to make our capsules, the capsules machine, very convenient. Packaging, different type of packaging depending on what you're making. Suppositories, tablet, lollipop, tube sealer for the cream, the capsules, machine to make your capsules. Oral formulation, we can make suspension, solution, lotion, tablet, could be sublingual, oral dissolvable tablet, chewable, effervescent, compress, capsules. We have spray, troche, lozenges, and lollipop. Yes, I'm reading a question here. If I have a laminar flow hood for any, yes, or all the powders We measure all the powder under the laminar float hood. It's not a requirement yet, but starting December 2019 of this year, it will be, which we're not too happy about because they're making things very complicated. The new USP 800. Topical, we do lotion, solution, cream, ointment, you name it. Okay, beyond use date and storage, very, very important when you're compounding. You must have a beyond use date. This is a law requirement. When you dispense the prescription to the patient, you need to tell them how long it's going to last. They need to know how to store it. It's very important. And for every non-aqueous formulation, this is a federal requirement. You cannot have an expiration date on more than 6 months. It could be less because sometimes some of your ingredient will expire before 6 months. So whatever ingredient expires first, that's when your final product will expire. Let's say you're making Tylenol and one of the ingredients in your formulation will expire in May. Even though you're making Tylenol capsules, technically the expiration date is 6 months, but because one of your ingredients expire in May, your beyond use date on the final formulation will be May. You cannot put 6 months. And they should be stored at room temperature for non-aqueous formulation. Okay, anything with water should not be more than 14 days. But if there is a study on the formulation that you're using and you're using the same ingredient as far as active ingredient, the API or the base that were used during the study, and the study showed that that product can last more than 14 days, even if it has water, you can use that beyond use date. But there should be a study that you have available for audit if you're going beyond 14 days. And anything with water is recommended to be stored in the refrigerator. For topical and transdermal, mucosal, semi-solid formulation, no later than 30 days, stored at room temperature. And again, some of these, if there is a study on it, you can go past the 30 days, but you need to have a study and a proof of the study available. Okay, USP 800 overview. I thought this was important to know because this is something new. We've been fighting it, but it finally went through. Starting December of this year, all compounders, non-sterile compounding, this is only for non-sterile, have to comply with USP 800. And with USP 800, we're going to have to build inside the facility to be able to fulfill the USP 800 because now all the hazardous, USP 800 is only for hazardous. All the hazardous product has to be done inside the laminate hood. And the laminate hood has to be vented outside the facility. There's a lot of requirement. You need a negative pressure. You can do it under positive pressure because what we're doing now is under a positive pressure. You just do it in the regular room where you fill your prescription. But after December, we will not be able to do that anymore. And most of the hormones that we do are under the hazardous. So we're going to have to build something here before December to be compliant. And there should be a written policy and procedure in place for hazardous drug. We need to retrain the staff for hazardous, and we need to perform and implement a risk assessment and designate a person responsible for the USP 800. And I think this came about when we had the incident for meningitis in the sterile pharmacy. I think that was 3-4 years ago. Yeah, they start looking everywhere. Okay, these are the few equipments that we use for compounding. In the far left, this is the capsule machine. This one is a 100. We use this to make 100 capsules. We have another one that we make up to 300. This is my laminate flow hood here, and this is the balance inside. And on the right of my balance, outside the hood, I have the computer that we use for compounding. This is the electric motor and pestle that we use for mixing. This is the hot plate right here. Okay, and that concludes the end of the presentation. I hope you enjoy and that you have a lot of questions for me.
Thank you, Dr. Camden. That was amazing. Do we have any questions pending before we continue? If not, we'll go ahead and relaunch the questions that we did in the beginning. And if you don't mind, if everyone on the call can go ahead and, if you have available, type your NABP number and your name, either through a private chat to me. If you look on the participant list, you'll see me listed as Camfi USA. You can send me a private message with your name and your NABP number for CE recording, or reporting, sorry, or just send it in the chat. But let me go ahead, while you do that, let me go ahead and relaunch the survey. Do you see the survey? Anybody? Oh, okay, not yet. Let me do it again. And we do have a question, Dr. Camden, when you're ready.
Okay.
All right.
I don't see the question.
So the question is, what is included in the lot number?
Okay, the lot number.
Yes.
Yes, the lot number has the date that the product was made. So the day, the month, and the year, and then the lot number. The a number corresponding to the number of the line number of the prescription. Let's say this is prescription number 1 that we're making today. So we're gonna call it 04 28 2019 at 1. So that means it was the first prescription that we did today. So that's how the lot number is made.
So Dr. Camden, I guess, to follow up on that question, do you then have some sort of a manual or electronic log where you match that same lot number to the list of ingredients and the quantities and the lot numbers and expiration dates of the ingredients that you actually used?
That's a very great question. Yes, before you compound, the way the computer, we have a compounding area with a computer that is designated just for compounding. And the way it's set up, you cannot move forward, one, if you don't calibrate your balance, and two, if you don't match the ingredient with what you're using. And we have in our SOP, we follow the same procedure when we're making. So after you match the lot number in the computer with what you have in your hand, it shows you have a green check. And to go measure it, weight, you move with what you have in your hand and you just match to the computer. You don't put it down and do something else just to prevent error. Yes, we have a system that allows us to verify that.
Okay. So we have another question. Are you audited against the insanitary condition guidelines?
Yes. Yes, I got the state board here twice, and they will look everywhere under your sink. They will check your water, make sure your compounding area is clean. And no matter how busy we are, before we leave, we need to clean up. That's part of your SOP. You need to put in your SOP, what you're expecting from your staff as far as, sanitary condition. Yes.
Okay. And given your experience in the world of both retail and then additionally now compounding, do you think that the future of pharmacy is going to take retail pharmacy into more of a compounding space, or more of a specialty? It's going to be directed more into the specialty pharmacy space?
Yeah, I think the future is going to be more of specialty compounding because people today are looking for more of natural. I have a lot of people coming here and they want to get the medication with nothing in it. I have patient progesterone, for example, is really bitter, but I have a lot of customers. When I make their progesterone, I add nothing to it. They don't want anything added. They just want something natural. So, and more people are looking for more into compounding. And you have this trend now, functional medicine. They're not going to a traditional doctor anymore. More people are going, even though it's costing them more, they're going to a doctor who can prescribe something natural. And also when you do compounding, you constantly learning, studying, because people bombard you with questions. Doctors, they will call you and with questions that you couldn't even imagine, because they have this case that they cannot resolve. They don't know
Mm-hmm.
what to do with this customer, and they will call you and say, hey, I have this customer, I need your help, and you need to come up with the solution. And the key is you never tell them I don't know. You need to have like a good backup system. Like you're, I use PCZ. I'm not making any publicity for them, but I'm very
Mm-hmm.
satisfied. They have like 3,000 plus pharmacists there, and every time you call, they know where to point you for the research, or they have if they don't have the answers. So it's very helpful.
So, do you think that traditional retail pharmacy is going to start seeing more of these demands? So, the Walmart, the Walgreens, the CVS's, Rite Aid, Target, Kroger. Do you think that we should anticipate getting more and more questions around compounding and functional medicine and naturalistic therapies?
Yes,
Okay.
because yes, I think that's the way to go. Yeah, and if you want to differentiate yourself from others, this is what you should do. It's very fulfilling. I mean, since I started this journey, I feel like, I'm a pharmacist. Because,
Mm-hmm.
yeah, there's a lot that I didn't know, was even possible. Now I'm seeing things differently, like supplement. Because when you do compounding, you need to know the supplement. You need to, yeah, people will come and ask you questions about supplement too, so you need to know them.
Mm,
It makes you read a lot. And
okay.
mhm.
All righty. I think we're ready to go through the questions. Do you want to review it with the audience?
Sure. Okay, the answers.
Let's see.
Okay, let me see. Hold on, give me a minute, let me scroll. Okay, good. Okay, the first question was yeah, I think majority got the answer right for the first question. Compounding pharmacies are exempt from FDA drug approval, and CGMP are most added to US 795 and US 800. And again, this is for non-sterile. A compounding pharmacist is expected to inspect and approve all components, drug product, container, labeling, and any other material involved in the compounding process. Yes, the answer is true, because it's just like a regular prescription. You need to make sure that at the end of the day, what you're giving to the patient is the correct medication. And with compounding, any little you need to be extra careful, because we deal with milligrams, micrograms. So if you get your math wrong, you could kill somebody, because the mistake is usually multiplied by 100 or 1,000. So we new prescription, we super careful. There's no rushing. The wait time is at least 2-3 hours, because you need to make sure that your math first is right before you even think about making it. The compounding technician or trainee does not need to obtain appropriate continuing education. The answer is false. Everybody involved in the compounding process need to have the continuing education training, and that's the only requirement that must be done to renew the license. Okay, for compounding, yes, you can anticipate prescriptions, but if you do so, you must label it. And the purpose of labeling, the right answer is D, the last one. We have 8 people answering that right. You need to label it with the name, the strength, the facility, lot number, the beyond use date, the quantity in the container, because that's the only way for you to know exactly what was used. And the labeling and the lot number is very important because sometimes in the cabinet you have progesterone 100. So let's talk pick low dose naltrexone. You have low dose naltrexone 1 milligram next to low dose naltrexone 1 milligram. They look innocent. You might think it's the same, but the lot number we take tell you exactly what is the difference between those two lots. One, we use magnesium, and the other one we use lactose. So you need to, when you're grabbing the drug to do a refill, we punch the lot number in the computer to see what are the ingredients and match it with the label of the patient before you dispense it.
Okay. We're getting some comments that some people can't hear you very clearly. I'm not sure. I can hear you just fine, so I don't know if you just don't mind speaking up a bit louder.
Okay, no problem. Water containing oral formulation have a beyond use date of no later than 30 days when stored in a controlled cold temperature. Yeah, the answer here for water, I said, any beyond use date, we have exceptions if you have the study, but anything with water is 14 days, not 30, unless you're doing a cream. If it's oral, it's 14 days, but it can go beyond 30 days if there's a study. So the answer here should be false. That's the standard answer. Okay, non-aqueous formulation have a beyond use date of 6 months, even if an active ingredient in the formulation expires sooner. The answer here is false. You go with whatever expires first. Okay, somebody is asking me a question regarding magnesium versus lactose in compounding low dose naltrexone. Magnesium is very good for pain. So if you have a patient and they've used lactose, the low dose, we always standard, unless you're allergic to lactose, we do naltrexone in lactose. But if the patient is not responding, we will do it in magnesium because we recommend people having neurological pain, any type of pain to be on magnesium glycinate. So if you don't respond to our low dose naltrexone with lactose, we will switch you to the LDN in magnesium glycinate.
Nice. Any other questions? We're gonna conclude in a couple of minutes. Okay, there's one more question.
For the studies, yes, it has to be a study that is published. You cannot go on Wikipedia and look for the study. You have to go through a valid journal of medicine. And again, if you're using a consulting company, they have the studies available for you. If you don't feel like looking, you call them, they send you the study. But it has to be a published study by a valid, yes, journal.
Okay, while we get more questions, I'm just going to go in the interest of time through some housekeeping items. Just a gentle reminder, we do have our second annual convention coming up in July in Las Vegas, the fabulous Las Vegas. We will have what we just had here on steroids, really. So we'll have a full day of learnings, CE available, and we really would appreciate a good turnout. So if you don't mind, join us. We'll have a lot of fun. Our keynote speaker is the highly acclaimed Agatha Achindu. She's the founder and CEO of the first organic baby foods brand in the U.S. called Yummy Spoonfuls, and she also happens to be Cameroonian. So we're very excited and very proud of her presence and her ability to come and honor our organization as a keynote speaker. This is a sample of our program. Here are some topics. If you look on Saturday on the right hand side, from about 9 a.m. till about I think 5 p.m., we will be in full blown scientific mode. So take a look. You can find the same information on our website, and the registration is currently open. So as far as CE, claiming your CEs, this program was accredited for zero point 0.5 hours of CE. The code is listed. Please write down or take a screenshot. In order for you to actually get the CE, we do have to send a list of the attendees at tonight's session, along with your NABP number, to the board, Nevada Board of Nursing, who's the accreditor of this program. So, okay, thank you. I just got someone's. If you don't mind putting that information in the chat or emailing it to the email address listed, we would really appreciate that. We do have these webinars, like I mentioned, once a month. Our webinar in May, we're going to be talking about board certification for pharmacists. So that would be a really, really exciting one. That's a hot topic for a lot of our members and pharmacists in general. We all understand the field is getting a lot tighter. So doing anything that you can to set yourself apart is very, very highly acclaimed. So be sure to join us. You can register on the website listed. And if you don't mind leaving us a review on our Facebook page, if you enjoy these webinars, it's good for us to hear that and any feedback you have, for us to be able to make these better. Any topic suggestions that you would like to have in the future, please share that with us. We're always looking for opportunities to improve not only our organization, but the lives of pharmacists globally. If you're a registered member, these slides will be available. Dr. Camden's email and contact information will be made available to members. If you are interested in compounding, you would like to learn more information, you can reach out to her directly and you can get access to the slides. So just to conclude, thank you. This was a phenomenal webinar. One of the best ones I've attended, if I must say so myself. So thank you, Dr. Konauer, for taking the time to create these slides, to share your knowledge and experience with us. We really appreciate it, and we definitely want you back.
Oh, thank you.
If this was a room, I would ask everyone to give you a round of applause, but we're virtual. So we're sending you virtual applause.
Thank you.
So appreciate everyone's attendance and have a good evening. Have a great week. Let's go out there and make pharmacy count. I'll keep the chat open in case there's any other questions. And for anyone who is who has not yet submitted their NABP information, please do so before you get offline, or email that information to the email that is listed on the slide. Thank you again and have a great evening.